Well, personalized medicine is certainly something which is extremely interesting because at the moment we are able to know and to analyze the molecular characteristics of the tumors, and this has led to the choice of specific therapies for specific patients for specific tumors. In this way, we do identify which patients are more likely to benefit from a determinate treatment, and so we can use this treatment only in those patients that will likely have a benefit, and we can avoid side effects and toxicities in those patients that are not likely to get a benefit from these treatments. Certainly the most evident example of this is in the treatment of lung cancer, where when we can identify the presence of a mutation in a specific protein, we can use target therapies that are much less toxic than chemotherapy and more effective. But this is slowly spreading also to other tumors, such as, for example, to melanoma. The development of liquid biopsies is really opening new windows which can give unexpected results. So just recently FDA approved a test performed on a liquid biopsy, which means on DNA extracted from the blood, and that would allow to identify tumors that will respond to specific treatments. So we can get an insight of what the molecular biology of the tumor is just by looking at the blood of the patient. We do not need to perform aggressive procedures such as surgical procedures to remove tumors or to take biopsies, but just by looking at the circulating DNA, which we can find in the blood of the patient, we can have the same degree of accuracy in analyzing the characteristic of the tumor. At the moment, the problem of overdiagnosis and overtreatment is becoming more and more important. For many years it was just a neglected item. The point at which we are today is that screening for prostate cancer is now much less supported than it used to be, and also for screening for breast cancer is now a very delicate issue, because what we see is that in many cases we identify tumors in women, and because of the characteristics of the women and of the characteristics of the tumors, it is probable that these tumors would have never caused any damage to these women. So what we hope is that by getting a better understanding of the molecular characteristics of these tumors, we can really identify those that are dangerous for the woman and give adequate treatment to these, and at the same time identify those tumors that are less aggressive and that might be treated with less aggressive and less toxic treatments for the woman. This is really personalized medicine, not only looking at the DNA of the tumor, at the DNA of the patient, but also looking at the patient and involving him as a person in the treatment of his cancer.